So this is a question on one of my videos. So the question is, do you do a package for people coming from the UK to you to have this procedure done? So that's a very interesting question. Obviously, this refers to a belt lipectomy for international patients. So UK coming to the Australia. It's hard to give a package because there's so many variations of the operation. So, for example, belt lipectomy, I assume this is post-weight loss surgery. So it may require liposuction or suction-assisted lipectomy. It may be circumferential. It may actually be that you need a fleur-de-lis or extended abdominoplasty, or you need other procedures with it. So there are many different options for a belt lipectomy or body lift or 360-degree lipectomy. Now, so that's one thing. From UK, possibly you can get Medicare Access. I'm not sure, but there might be a deal between UK and Australia for that. So that's something you need to find out before you come as well. Because if you do have Medicare Access or private health insurance or something like that, that will make the cost of the procedure quite significantly different than if you don't. So make sure you verify your options there and eligibility as well. Now, if you're coming internationally and having the surgery here, then really, especially if you're coming from the UK, which is a long trip, I would recommend, 4 weeks to stay here to make sure that we get over the initial recovery period, manage any wound issues, and all that sort of thing. You don't want to travel straight after surgery because of the risk of DVT, clots, and other issues that you may have. So that is really important. Then you also have to consider the post-return care. So I assume you're going to have a UK-based GP that can manage any sort of minor little wound-related issues. Generally, it's the wound management that is going to be the key thing. If you're post-weight loss, having a big incision like for the body lift or belt lipectomy, there is a very high chance of having wound breakdowns. Most of the more serious stuff would be managed within that 4 weeks, but you may have still some breakdowns and something that a GP might have to manage on your return trip. So what do you do if you want to come down here? So first thing is to do a consult. So a Zoom consultation is what we offer initially. I would ask you to send some images because usually the Zoom is a little bit grainy. It's hard to tell on the Zoom exactly where the skin is and internal fat and all the other things. So send through some images and we can tell you exactly which angles that the images should be. Now, costs. Again, depending on Medicare Access, depending on private health insurance, depending on other things, it may vary quite significantly. So we have to work out the operation first and then we can work out the costs. So you got the surgical fees, you got the anesthetic fees, and you got the hospital fees. You also have to add, if you're traveling from a long way, you have to add obviously travel costs and accommodation costs for staying here and possible additional fees for aftercare and follow-up consults. Now, I don't charge anything for the follow-up consult, so that's all included. All the aftercare with me is included as well into the initial surgical fee, so none of that is going to cost you anything. Now, you will need a travel companion because you are going to have a big operation if you're going to have a belt lipectomy. So your travel companion will help you take you back from the hospital, make sure that you come for your appointments, that sort of thing. So that's really important as well. So I would say it's a big trip. I think it's worth it, but there are certainly local surgeons at your area that you can see as well for these things. So certainly that will be a recommendation for me because it is a bit of a trip to come down here. It's a long distance, it's a foreign country, all that sort of thing. Hopefully this has been helpful. And I'll see you in the next video, and make sure we comment down below so we can have lots of questions and comments so I can do more videos like this.